Our next speaker is Megan Weigel, a nurse practitioner specializing in neurological care in Jacksonville Beach, Florida. Megan is an MS certified nurse since 2005 and a nurse practitioner for over 20 years. She is a board certified advanced practice holistic nurse and earned her Doctor of Nursing practice from the University of Florida, where her research emphasis was on preventive healthcare. She served as past president of the International Organization of MS Nurses and the co-founder of OMS Yoga. Is it OMS Yoga?
OMS Yoga.
OMS Yoga. Got to ask about that one. A nonprofit organization that brings free yoga classes to people living with MS. And again, you can find that at omsyoga.org. She is the best-selling author of Monday Mantras with Megan, available on Amazon. Megan will be speaking to us virtually from Florida on the topic of acupressure for MS. And there are cards on the tables, right? That I think you can refer to that as well. So grab those little note cards and take notes. And let's
virtual exhibit hall for anyone who's online.
In case you didn't hear that, they're also online on the virtual exhibit hall if you're watching the webinar. All right. And is Megan available?
I'm here. Can you see me?
Megan, yes, she is. All right.
Yay.
Fantastic. I'll leave it to her.
Hi, Megan.
Hey guys, it's so good to be with you, Trent. I'm sorry I'm not with you in person. I just did brain speedball with somebody in my office last week. It's really great. I hope you guys pick it up and try it. So, Mindy, tell me how I'm doing this. Are you driving slides? Am I driving slides?
Can you drive the slides?
Yes, let me make sure that I can share my screen. And let's see, what did I do here? Here we go. Perfect. All right. Awesome. All right. So I've got a little bit of time to talk about one of my favorite subjects and how it's relevant to you who live with MS. And my biggest takeaway today that I want you to leave with is how to help yourself with some self-acupressure points. That card was a really quick turnaround. Mindy and Lori, thank you so much for getting them out to people. I think you'll find them very helpful. The cards that are in front of you or in the virtual exhibit hall list some self-acupressure points for various symptoms. And I'd like to talk today about the healing touch of acupressure, give you a brief history of the type of acupressure that I teach, review the benefits in MS, and then provide you with some self-acupressure points for emergency care. Acupressure is acupuncture with your hands, so no needles. It's over 3,000 years old, and historians think it's actually probably older than acupuncture. Healers discovered way back in the day that stimulating certain points on the body improved health and wellness. I think that's really evident to all of us who've enjoyed a massage and felt not just that, gosh, our area of pain might feel better after the massage, but perhaps our anxiety level was better as well. So part of the physical body, it holds a lot of our physiological and emotional stresses. So acupressure is based on principles of Chinese medicine. Some of these principles are that energy flows through the body in meridians, that man is connected to heaven and earth through this chi energy, and that health requires balance between the mind, body, emotion, and spirit. And in the olden days, acupressure was passed down through an oral tradition. And really up until the mid 20th century, it was passed down through an oral tradition. There are many forms of American acupressure, and the forms are different in their technique and philosophies. I am trained in clinical acupressure of a type called soul lightening. The lineage begins with a gentleman named Master Murai. He was a Japanese gentleman who became very ill. And in dreams, he was given this information to heal himself through acupressure. He developed something that he called Jinshin Jutsu through his own healing. And he traveled around Japan sharing this tradition orally. He was called the Barefoot Doctor. At some point in his journey, he met Mary Burmeister, and she was a Japanese American who was in Japan studying her lineage. She was raised in an internment camp in America during World War II. And he asked her specifically to bring this Jinshin Jutsu to America as a gift of reconciliation and healing after World War II. And she did. Jinshin Jutsu found its way around America, and the founder of Soul Lightning Acupressure, whose name is Dr. Amina Rahim, she's a psychologist, was taught this type of acupressure from Georgia Moody. She's the founder of Soul Lightning. As we come to know it, you'll learn that there's more to Soul Lightning acupressure than the Chinese meridians. Dr. Rahim was a student and practitioner of transpersonal psychology, and she was interested in the soul as the divine essence of the human being. She saw the development and support of the chakras as important to soul consciousness. So not just including the Chinese meridians, but also the chakras in the healing system. She wove these soul principles and that of the great central channel, which includes the governing and conception vessels, which are Chinese meridians, into the system of soul lightning acupressure, with the concept that this great central channel is absolutely essential for soul lightning acupressure because it touches everything, and strengthening it allows integration of the body, the mind, and the soul. So much of the purpose behind soul lightning acupressure is helping a person with soul clarity and finding their soul purpose. Soul lightning acupressure uses what we call an interface touch, and that's a touch that allows, invites, and encourages the healing in the person's body. It separates the energy of the practitioner and the patient. It provides clear boundaries, and it also conserves energy for the client and the practitioner. And so what it would feel like if we were in person is just a very gentle fingertip pressure with a fulcrum or a little bit of a hook that stretches the skin. It is barely any pressure. It would almost feel like you were putting a nickel on your skin. Typical sessions of soul lightning acupressure include a balancing protocol, a central channel release, a chakra balancing, and grounding. And the evaluations for what you need are based on either your clinical complaint. So let's say I have back pain and I would like a session of acupressure around helping my back pain get better, or the assessment of the provider. So maybe I check pulses, I ask you some questions, and I devise a session based on a meridian that needs balancing, or something called process work. Process work involves you as the recipient of acupressure using cues from your own body to process through a certain situation that includes balancing the energy of your body. Sessions may last anywhere from 20 to more than 90 minutes. And even if you're just doing clinical acupressure, process may occur. And what I mean by that is many of you may have had other types of manual medicine like craniosacral therapy, massage, Reiki, even chiropractic work, acupuncture, where you had some spontaneous release of emotion. It might have been tears, it might have been laughter, it might have been a memory that popped into your head, made no sense at all. You don't know where it came from, but it's a result of the body moving energy through and letting go of, or moving what it needs to let go of for a higher consciousness. So the purpose of soul lightning acupressure is to nourish, recharge, and rebalance. Dr. Rahim used to say, still says, wherever energy is flowing freely and in balance, disease cannot manifest. So let's just think about our shoulders for a second, because I'm going to give you a point for those. How many of you hold tension in your neck and shoulders? Like walk around like this all day long. It may cause neck pain. It may cause headaches. And so that energy is stuck there. When it's stuck there, the energy can't flow freely, and disease can manifest. And that disease would be considered to be the neck pain or the headache. So basic principles include energy flow in the body promotes wellness and opens new awareness. touch and flow of love from the heart are healing and strengthening. Every person, each one of you carries your own healing and wisdom within. And the purpose of soul lightening acupressure is to empower that individual inherent wisdom. And that's why I say that if process happens during a clinical acupressure session, that is okay. So this is a picture of the soul lightening acupressure points. There are 36 of them. They're on all of the different meridians in the body. And these primary points are all touched during a soul lightening acupressure session. But there are also other points that are consistent with acupuncture meridians that we may touch with our hands. A hand is always beneath you and always on top of you. And that we believe helps with the flow of energy. The meridians and the elements associated with Chinese medicine include fire, earth, metal, water, and wood. The fire meridians are the small intestine, the triple warmer, the heart, and the pericardium. The earth meridians are the stomach and spleen. Metal are large intestine and lung. Water are bladder and kidney, and wood are gallbladder and liver. Now, in Western medicine, we speak of our organs very differently than in Eastern medicine, we speak of meridians. So certainly some of these meridian systems may have symptoms associated with the quote organs if they're out of balance. But sometimes the symptoms associated with those meridians being out of balance are completely unexpected by a person who doesn't know Chinese medicine. So this is all that we're working with. We're also working with the chakra system. It goes all the way from the perineum up over your head to your higher consciousness. And all of these areas are addressed when we're doing soul lightening acupressure. I think I'm doing a pretty good job here with time. So I'm going to keep going at this speed. The benefits of acupressure in MS published are fatigue, pain, anxiety, and then the benefits could be any other symptom that you have related to MS. We just, take the MS out of it. There are clinical protocols for spasticity, for bladder issues, for constipation, for diarrhea, for pain in any part of the body, for nervous conditions. But the potential for harm is much lower than other things. So there's a low potential for harm. The greatest one being possible discomfort, depending on your positioning. And then also be sure that you're working with a certified practitioner. So acupressure should also be something that a person is certified to do in your state. So in the state of Florida, people who can provide you acupressure are people who are licensed to provide touch therapy. So in the state of Florida, that's nurses, massage therapists, probably physicians, I just don't know, and then rehabilitation professionals. It's different in various states. So you want to be sure that the person who's touching you is certified and licensed to touch you. And then touch and energy therapies can cause emotions to surface and release. That's what I mean by process. And because many people who live with anything, most people who are just alive are dealing with some sort of trauma, it's very important to recognize that these emotions that surface need to be dealt with. So it's important to discuss these with your practitioner and seek mental health help if necessary. If something comes up for you during a session, you're just not sure what to do with. So without further ado, let's give you some practical points here. This is a really great point for anxiety. And if you put your palm up with your palm to your face, you're going to be looking at the pinky side of your hand, just under your wrist crease. So you can go like this with your hand and you'll feel some tendons, like some spaces in between tendons. And you don't have to get too caught up in the details, but if you come down in between your pinky and your fourth digit, straight down just under your wrist crease, this is heart 7. It's also called Spirit Gate, such a neat name. It's called Spirit Gate in acupuncture. It's also some of our soul lightning points have the same names as acupuncture points, but the names just really tell a story. This is a wonderful point for anxiety. If you hold it with a gentle pressure for 30 seconds to a minute on each side, and you can do this anywhere. I mean, you could do this while you're waiting at a doctor's visit. You could do this when you're talking to a person who makes you anxious. You just hold the point for 30 to 60 seconds. The next points are for fatigue. And believe it or not, there have been several studies that look at these specific points in acupressure for fatigue in people who live with MS, and all of them found some benefit. So the first one that you can do to yourself is the large intestine 4. It's called pain relief. And it's in this V here, in between your thumb and your first finger, like in that fleshy part, a little bit closer to your first finger. You hold that point for 30 to 60 seconds, and you would do these on both sides. And then the second point is called leg 3 miles, and it's just under the outside of your kneecap. So you can, if you put cup your kneecap in your hand and pick up your pinky finger, and then move your pinky finger down below your knee about 2 or 3 centimeters, so 2 or 3 finger widths. That is leg 3 miles. And you can do both sides at the same time because it's easy. You don't need, 2 hands. You just need 2 knees. You can also cup underneath your knees with a C with your hands, and you'll grab a bunch of different points that are nice and nourishing. And then the third point is leg 3 miles. Now, leg 3 miles is about 3 finger breadths above your inner ankle bone. So the top of your inner ankle bone, just place 3 fingers. And then just above that third finger is leg 3 miles. So going in order from the little thumb pillow right here to just under the knee to leg 3 miles, which if you don't get dizzy when you bend over, you could do both of those at the same time, or you could sit on the floor and do both of those at the same time. Those are the points that have been studied and shown to be effective in improving fatigue in MS. And I would say that those points, the studies were in sessions with those points for several weeks in a row. But I also believe in the benefit of using these points on a daily basis, depending on what symptom you're trying to treat. And the last point is the one I mentioned earlier about neck and shoulder tension. This is, I love our name for this in Soul Lightning Acupressure. It's called excess baggage. And you're basically just about halfway across in between your neck and your shoulders on both sides. You're just holding that area where you feel the most tension in your neck, right on the top of your trapezius muscle there. And it just feels really good. You put in a little pressure in there, again, hold it for 30 to 60 seconds. So that's my really brief acupressure overview for living with MS. I hope you find the cards effective. I'm just going to go ahead and I think I can play. This is the trailer from Monday Mantras with Megan. If any of you are interested in the book, and there's a QR code here right after this that I'll leave up and you can snap on.
Megan, we're not hearing your video.
Yeah, it's okay. I'll talk it.
Are you talking, Megan?
No.
I'm just wondering.
So there was a little talking part, and I realized as it was happening that when we did last week's, it can't come through the computer like that. It has to be played on your end. So not a big deal. But acupressure can also be used as mindfulness. So doing those points for a couple of minutes each day is a mindfulness practice. My book, Monday Mantras with Megan, is a weekly mindfulness journey. So it just gives you a mantra each week to focus on for the week, moves you through the use of yoga, creative practices, essential oils, and breath work to help solidify the work behind the mantras. And the bottom line is mindfulness is so important for brain health. So I hope that you take something away from today's symposium that you can incorporate into your daily life. And I will go ahead and I think I'm going to look in the chat. Is that right?
Yeah, you can look in the chat. I do have a few questions here too.
Okay, perfect. Let's go.
While you're looking, you can multitask.
Yes.
Mindfully.
I'm mindfully multitasking.
Should I try dry needling?
Well, so dry needling can be helpful for certain painful conditions and muscle spasm. It's something that in certain states, physical therapists can do. You need to make sure that the person's licensed to do it. So really the answer just depends on what you're looking for and whether or not a physical therapist can do it and would think it would be effective for you.
Okay, one other before you look at the Q&A online. Will acupressure help with swelling in my feet and ankles?
Yes, that's what I'm getting to right now online. So I guess it's the same person. So it certainly could.
Megan, can you take the QR code off and then we can see you full picture?
Oh, I didn't know. Yeah, there you go. Perfect. So yes, acupressure could help with swelling in your feet or ankles. You would need to have an assessment by a person who does acupressure to find out what protocols were needed. In my mind, swelling in the feet or ankles could mean that there's a block in your water element or in getting to or away from it. So it's a pretty sophisticated system when you're doing an assessment for acupuncture or acupressure. But if it's something that you have not made headway with in conventional medicine, then you might want to talk to an acupuncturist or someone who's certified to do acupressure.
Thank you. And for those of you in person, we do have an acupuncturist here.
Yay.
What do you see online in terms of Q&A?
So that was it. I saw Barb's question and then they couldn't hear me, which they couldn't hear that video part. So we've
one
addressed
question. What are the points for sciatica? Are they specifically?
Yeah, so there's not a specific point for sciatica. There is a self acupressure point for back pain. It's just behind the knees. It's called back drain. And if that's a person who's on virtually, then that is, it'll be on that card that's on the virtual exhibit hall. There are protocols for sciatica. And I can't, it requires assessment. So one of the wonderful things about Chinese medicine is that every person is different. So a protocol for sciatica for the gentleman I think it was a gentleman who asked the question might be different than for me.
Does acupressure work as well as acupuncture?
Yeah, so I'd be curious to hear what the acupuncturist says. My belief, so I've been receiving acupuncture for, 20 years, like regular acupuncture. Acupressure does not claim to move qi. So qi is energy. There are certain types of acupuncture where the practitioner is the mover of the qi. So we are not doing that. We're inviting the body to initiate its own healing mechanisms. So whether or not it works as well as acupuncture, I would say it works differently.
Okay. I know I've been getting it for years. It's my best nap.
Yeah, absolutely. And, acupressure is something that you can do for yourself, by using some of these points. So if you were to have a regular acupuncture practice, but you needed some, some tweaking in between or some reinforcement in between, then some of those acupressure points may be helpful to do that.
Is there an acupressure point for leg spasticity?
So I would use back drain. It's on that card. It's just behind your knees. If you put your hands right behind your knees, you can almost feel your popliteal pulse if you're a pulse whisperer like I am. But right behind your knees in the center.
Do you touch your palm close to it? Is there any pressure? You just
take your fingertips and feel for the center of your knee and place a very gentle pressure. So as a person who practices acupressure, I feel pulses, and they're not pulses like I'm your nurse checking your pulse. They're energetic pulses. Not everyone, not other practitioners, feel pulses, but still touching those areas helps, encourages the body to move energy. So don't worry whether or not you're doing it right. Just touch the points.
Thank you.
Yeah.
Can acupressure bring on emotions like acupuncture does?
Absolutely. Yep.
That was easy.
Yeah, that was easy.
All right. Well, thank you, Megan.
Thank you, Mindy.
Can't wait to see you at CMSC.
Yay, I'll see you in 2 weeks. I can't wait. Thank you, guys. I hope you enjoy the rest of your evening.
Thank you so much for joining our community.
Thank you. Bye.